What is the survival rate for cervical cancer survivors? Have you ever wondered about the survival rates for cervical cancer survivors? Understanding these rates can provide hope and clarity for those affected. Cervical cancer survival rates are influenced by several factors, including the stage at diagnosis, access to effective treatments, and the overall health of the patient. Generally, when cervical cancer is detected early, it has a favorable prognosis. However, survival rates decline significantly with more advanced stages of the disease. In many developed countries, the overall 5-year survival rate for cervical cancer is around 66 to 68%. This means that about 2/3 of women diagnosed with cervical cancer will survive at least 5 years after their diagnosis. For those diagnosed with early-stage cervical cancer, the survival rates are even higher, often exceeding 90% for localized cases. On the other hand, survival rates drop for women with persistent, recurrent, or metastatic cervical cancer. For these patients, the median overall survival can range from just under 2 years to slightly over 2 years, depending on the advancements in treatment options available. Recent clinical trials have shown promising improvements in survival rates for advanced cervical cancer. New therapies, including immunotherapy agents like cadonilimab, have demonstrated benefits in both overall survival and progression-free survival for patients facing persistent or recurrent cervical cancer. For instance, median progression-free survival has improved from about 8 months to over 13 months, while median overall survival has extended beyond 22 months in treated groups. Emerging research also highlights the role of biomarkers in predicting treatment response and survival outcomes. Certain mutations in genes such as ARID1A and B2M are linked to poorer disease-free survival following chemoradiotherapy in locally advanced cervical cancer. These findings suggest that personalized treatment approaches targeting these pathways might improve survival rates in the future. Global efforts are focusing on prevention through human papillomavirus vaccination and screening programs. These initiatives aim to significantly reduce the incidence and mortality of cervical cancer. The World Health Organization and various countries have established targets for HPV vaccination, coverage, and cervical cancer screening to help eliminate this disease as a public health problem. By preventing advanced stage diagnoses, these measures are expected to improve survival rates indirectly. In summary, cervical cancer survival rates are highest when the disease is detected early and treated promptly. Advances in immunotherapy and molecular biomarkers are enhancing outcomes for advanced cases. Additionally, prevention through vaccination and screening remains critical in reducing cervical cancer deaths worldwide. Survivors of cervical cancer benefit from ongoing medical follow-up to monitor for recurrence and manage any long-term effects of treatment. If you or someone you know is affected by cervical cancer, consulting with healthcare professionals is essential for personalized guidance and support.